sure everyone in this room has seen the commercial for the cervical cancer vaccine encouraging women and their daughters to become one less, and they're throwing out some crazy words like human papillomavirus, or more simply HPV. The Center for Disease Control and Prevention published a study in December of 2007 naming human papillomavirus the most common sexually transmitted disease in the United States, with an estimated 6 million new documented cases a year. Now 70% of those cases are ages 15 to 24. So please believe me when I tell you this is way more prevalent than you know. And a scary fact about this disease is people don't even know that they have it. I work in a doctor's office in Wheaton, and I'd say about 75% of my patients come in for some type of HPV treatment throughout the day. Most of my patients are that, and I spend about half of my time on the phone with patients educating them about this disease, how they might have gotten it, prevention, different treatment options that we offer, and believe me, there are plenty of them that are out there. So today, I want to talk about the three main aspects of HPV that everybody needs to know about. We need to know exactly what it is, what the symptoms are to look for, and also the treatment options. So we'll start with what it is. HPV is a virus that's one virus that causes more than one disease. It's a sneaky virus because it doesn't always have any signs or symptoms, and it can lay dormant in your body for up to 5 years. Now, you can get HPV through any type of sexual contact. It doesn't necessarily have to be intercourse. And there are about 40 different strains of the virus that they've categorized into two categories, high risk and low risk. So let's look at the low risk and the symptoms to begin with. Genital warts. Now, I guess I don't have to tell you where you find them. But you can see they can either appear like little warts that you find on your fingers, whatnot. They can appear in clusters. They can be burny, they can be itchy, they could just be annoying. Part of the time people come in and they say, oh, I'm having intercourse and it really, really hurts. And you kind of look in and, whoo, hello. So there's that. There currently is no treatment for genital warts. It does affect both men and women. And it's a little bit more the most common because it's so diverse for men and women. The high risk one is cervical cancer. The only way to detect this is by every woman who faithfully goes and has their pap smears once a year like they should, and that's the only way that it's detected. There is no symptoms. You go in and get your pap. And from there, what our office does normally is we will automatically order the reflex test to test for HPV. But as of right now, that's the only known test out there to confirm an HPV infection. You can't just walk in with no symptoms and be like, oh, I want to test for HPV, and they'll look at you like you got lobsters crawling out of your ears. It doesn't work. So, okay. We have something going on. What are we going to do about it? There's a couple different treatment options. For genital warts, like you've seen on TV for like your finger warts, they have what's called cryo-freezing. They put some cold nitrous on it, and it will shrink the wart, dry up, cause it to fall off. According to the Principles of Anatomy and Physiology, Volume 8 novel, though, 25% of genital warts cases will come back within 3 months of treatment. There are some ointments and creams, things you can do, but pretty much you just have to watch yourself and monitor for outbreaks. For the high risk, for the cervical cancer, there are 3 different known procedures right now. First is called a LEAP, where they go in with, let's just say it's a laser spoon, and imagine your cervix and everything is like a honeydew melon, and they just scoop out areas, leaving a lot of scar tissue, runs a lot of risk for infertility. I have experience with that. I was treated for the early stages of cervical cancer in 2000, and that caused a lot of fertility problems for me, so not always the best option. Another close one to that is called a colposcopy, and instead of just like a spoon scoop out, it's more of like a little cone. They cone out the area. As Dr. Frank Strell from Wheaton Strell Natural Health explained to me, the only known cure for high-risk HPV right now is called an esterotic treatment. It's a much safer treatment. They paint the cervix with zinc chloride and a couple other little mumbo-jumbo things, and it only causes the infected areas to implode on themselves and dissipate, and the body absorbs it and it's gone. Lowering your risk for infertility because you're leaving more of the good tissue intact. And it's a lot safer and it's more up and coming. So now we know the three aspects that you need to know: what it is, how you get it, and how to get rid of it. So hopefully you can take some of this home with you and maybe make some changes if you need, because this every day keeps growing in epidemic proportions and we need to start getting control back from it.